How much salt should I be eating? Should I be counting carbs or calories? Is it true that after 70, you should be eating less salt? Welcome to the channel. I'm a doctor. And today, we are going to talk about how much salt should you be eating. In this video, I am going to cover 3 questions. First of all, what is the relationship between your age and how much salt you should be eating? Well, there is no change in the amount of salt that we need in our body, irrespective of our age. They don't contribute to your overall salt intake. So now that we know how much salt we need, high blood pressure is dangerous and can lead to heart disease. So here's what the current research says. If you have normal blood pressure, consuming too much salt will not cause heart disease. Consuming too much salt may cause high blood pressure, but it will not cause heart disease. Actually, there is no evidence that after 70 you should be eating less salt. One group was asked to reduce their salt intake to less than 3 grams per day. Another group was asked to consume salt to taste. And at the end of the study, they found that the people who consumed salt to taste had lower rates of cardiovascular events. Make sure that you don't add too much salt at the table. And make sure that you read the labels of all the packaged foods that you're eating, including sauces and condiments and everything that you're putting in your mouth. Check the label, see how much salt it contains, and try to keep it as low as possible. Meaning they had less number of heart attacks and strokes compared to people who were on a low-salt diet. I recently made a video about hidden sugars in our diet. Please go and watch that video. However, this is a small study, and we cannot draw any conclusions from it. If you want to ask me any questions, please comment below or join my online clinic. I will see you next time. Bye-bye. In fact, after 70, you may actually need more salt in your diet, because what happens is that as we age, our kidneys start losing function. In this trial, they took 6,000 people with isolated systolic hypertension, meaning they only had high blood pressure. They didn't have any other risk factors for heart disease. And these people were asked to reduce their salt intake to 1.5 grams per day, which is extremely low salt diet. And they were compared to a group of people who were asked to eat a normal diet. At the end of the study, they found out that the people who were on a low-salt diet had more number of major cardiovascular events, meaning they had more heart attacks and strokes. So what does that mean? Does that mean that you should not restrict your salt intake? Does that mean that you should be eating lots of salt? Again, I have an answer. There is no clear consensus on whether restricting your salt intake increases your risk of cardiovascular events. As a result of that, our kidneys are not able to excrete salt as efficiently. So if you are a 70-year-old person, you may actually need 6.5 grams of salt per day rather than 6 grams. But if you already have kidney problems, then definitely you should talk to your doctor about how much salt you should be taking. The amount of salt that you should be taking will depend upon how much salt your body excretes, how much salt your body gets rid of. And that depends upon your kidney function. So if you have any kidney problems, please talk to your doctor about how much salt you should be consuming. But otherwise, there is no evidence that after 70 years of age, you should be eating less salt. Now, if you already have high blood pressure, then consuming too much salt will increase your blood pressure and potentially over a period of time can lead to heart disease. Is that true? Well, yes and no. Let me explain. You see, our body needs sodium and chloride, both sodium and chloride. These are the minerals that our body needs. Salt is a compound of sodium and chloride. So when we consume salt, our body absorbs sodium and chloride. Now, too much sodium in the body can cause high blood pressure. But having said that, if you look at populations which consume a lot of salt, for example, Japanese population consumes a lot of salt. Even some African communities consume a lot of salt. Their traditional diets are very, very high in salt, but their rates of heart disease are very, very low. So it appears that consuming a lot of salt doesn't necessarily cause heart disease. It may cause high blood pressure. But having said that, there is a caveat here. And what are the sources of salt? Let's move to the second question. The amount of salt, the requirement for salt in our body remains the same throughout our lives. How much is that? 1 teaspoon of salt per day? Before we talk about that, I have a request to make. Please subscribe to my channel and share my videos with your friends and family. It takes a lot of effort to research and write these scripts and shoot these videos. I don't do sponsorships or paid ads. I don't take money from any pharmaceutical company or medical device company. My videos are not influenced by any commercial consideration. So the only way that you can support me is by subscribing to my channel and sharing my videos. A teaspoon of salt contains around 6 grams of salt. So that's the amount of salt that you need in your diet. But many people have this question. Why do doctors say that we should not eat more than 6 grams of salt per day? Where did that come from? That came from a study called the Inner Heart Study. This is a study done across 52 different countries with more than 90,000 participants. And they found out that if you can restrict your salt intake to less than 6 grams per day, you will have lesser chance of getting heart attack and stroke. However, if you exceed 7 grams of salt per day, the risk starts to increase again. Secondly, is there any link between salt and heart disease? And thirdly, does that mean that after 70 you should be eating less salt? So let's get into this. First off, what is the relationship between our age and how much salt we need in our body? Now, it's important to understand that when you are counting your salt intake, make sure that you count all the sources of salt that are coming into your body. It's not just the salt that you add at the table. Yes, it's important to control how much salt you are adding at the table, but that's only one source. Other sources include sauces that you put on your food, ketchup, mayonnaise, mustard, soy sauce, relishes, pepperoncini, olives, condiments, cheese, condiments that you use like salad dressings and marinades, anything that you buy commercially, soups and processed meats. All these things contain a lot of salt. So when you're counting your salt intake, make sure you count all these things also, not just the salt that you put at the table. And in case you're wondering how much salt is there in vegetables, fruits, and dairy products, the good news is that these foods contain negligible amounts of salt. Is there any link between salt and heart disease? Many people believe that salt causes high blood pressure. If you take a person who already has high blood pressure, then consuming too much salt can worsen the blood pressure. So now let's move on to the most important question, which is, does that mean that after 70 years of age, you should be eating less salt? Now let's get back to the question, which is, does that mean that after 70, you should be eating less salt? There was one small study which involved 432 men between the ages of 65 and 75. They were divided into 2 groups. On the other hand, there is another large study called the Systolic Blood Pressure Intervention Trial, or SPRINT. What I think is that as long as your blood pressure is normal, don't worry too much about your salt intake. Talking about reading labels. Do you know that ice cream can have up to 40% of your daily calories coming from added sugars? If you're finding my videos useful, please subscribe to my channel.